Okay, you don't need to have any nightmares, it's working.
Okay, good. Nightmares are over. This is real life. Alright, I am just gonna I'm doing scene A for Frank Lipsy. I'm gonna give him a morphine direct. So I've just gathered all my supplies and done my first 7 rites. So my supplies are sterile normal saline, 2 saline flushes, a bunch of alcohol swabs, a medication label for the morphine, a 10 milliliter syringe, a filter needle because I'm using an ampule, and then a little blue cap to take the syringe into the room when I give the medication. And then I have my morphine here that I've done my 7 rites for and counted it in the narcotic count. Before I go into the patient's room, I'm just going to check their allergies just to kind of assess if there's any contraindications for this medication. And I'm going to just go do a few assessments and talk to my client first before I get started. So I'm going to wash my hands before, well, there we go. Before I go into the room, and I'm going to go see my patient and introduce myself. So hi, I'm Lara. I'm a second-year nursing student, and I'll be working with you today. I am here because I heard that you were in pain. I read in the report, and we have some morphine ordered for you. So I'm just here, and I want to do an assessment with you. So I'm going to do a pain assessment, including a full PQ or STU of the pain to his right femur. And then I'm also going to be doing vital signs, especially looking at respiratory rate and blood pressure, because that's what morphine affects most. And I just want to talk to you about morphine a little bit. I don't know if you've had it before. There's little sharks there. So morphine is an opioid, and it basically works on opioid receptors in the central nervous system. And we're giving it to you because you kind of do have that more like moderate to severe pain. You also have acetaminophen ordered, but that would be for kind of mild to moderate pain, and I think we need to kind of hit this with something a bit more potent. The side effects do include urinary retention, constipation, can have some nausea come up, and then it can also, the riskier one is respiratory depression, which I'll be monitoring for closely, especially because I'm giving it IV direct, and hypotension, so a drop in your blood pressure. So do you have any questions about this medication? And then I also just want to assess in terms of this, obviously I have a dose that's set, but if there was a range, I'd be kind of thinking about, have you had this medication before? Do you have any tolerance to morphine? Like the last dose, have you had a dose previous to this? And how effective was that dose? What dose was it? And thinking about his age, because it is like an elder alert medication, and then also his kind of size and weight and those things. So those are all things I would kind of think about when I'm rationalizing what dose I'm going to be giving him. And then of course also the current pain he's in. So as it said in the scenario, it's an 8 out of 10 pain, and I just have the set dose. So that's what I'm going to be giving. And then I just also want to ask about your allergies. I saw that I think you're allergic to sulfa and penicillin. And so I just want to see if there's any allergies you missed on there, and if there's any contraindications for this medication. Alright, I am going to be back. I'm going to get the medication prepared, and then we'll try and get you out of pain as soon as possible. I would lower the bed when I leave the room and make sure the patient is safe and comfortable, and I'm going to wash my hands, which doesn't seem to be working, but washing my hands, and now I'm in the med room. So I think I'm in the screen. Yeah. I'm going to be preparing my medication. So first I'm going to be looking at basically how I'm going to reconstitute this into a ratio of 1 milligram per milliliter. So using the monograph, I'm going to be going through red cars. Okay, so the first R is my pen. The R in red cars is rate. So I've done my DBT, dose volume time ratio here, and I'm going to be giving this medication via IV push at a rate of 0.5 milliliters in 15 seconds. So that's my rate, 0.5 milliliters in 15 seconds. And that is the max speed I can give this medication in via IV push. So I'm going to make sure that I give it slowly and at that rate. Then I'm going to go to E. So I've already stated my equipment that I'm going to be using for this skill. So that's what E stands for, so we're all good there. Dilution, solution. So I'm going to be looking at my monograph here. And for compatibility, so it's stable in normal saline for at least 24 hours at room temperature. And that's what I have here. I have sterile normal saline, so that's what I'll be diluting the medication. So that's good. Compatibility, I'm not going to be hanging it on a secondary line, so we're giving it push, so it's compatible with normal saline and there's nothing else that it needs to be compatible with at this point. A, so I've looked at his allergies, I've asked him about allergies as well, just to make sure that he doesn't have any contraindicating allergies to morphine. And then R, so reconstitution, I am not reconstituting this from liquid, but I'm going to be adding the sterile normal saline to make it a different concentration of 1 milligram per milliliter. And then S, stability, so I look into the monograph again under stability and compatibility, and as I said before, it's stable for 24 hours in this reconstituted state. So we're all good there. So now that I have my rate I'm going to give it at, I know that I've done my red cars. I am going to do my second set of 7 rights, so I'm taking my morphine here and just looking at the MAR. So I'm going to be giving this to Frank Lipstein, and the drug is morphine, so I'm just double checking that's the right drug. I'm going to be giving 3 milligrams, which will end up being 3 milliliters out of this 10 milligram vial, and then I will be wasting the rest of it. I'm going to give it IV, and there's an option here to give it IM or sub-Q, but IV I'm going to give it because he's got a saline lock in situ, and it's actually less invasive than poking him another time with an IM or a sub-Q. He's also in a lot of pain, so this medication, this way, will act quite quickly, which is beneficial in this situation. I'm going to give it as soon as possible. It's a PRM medication and he's in pain, which is the indication or the reason for the medication. So I'll write my time down once I give it, and then I'm going to document at the end. I'm just going to put a dot here that I've done my second check and I know that I'm good to move forward. Now I'm going to prepare my medication label. So the name of the client, just comparing to the MAR, Frank Lipstein. The medication is morphine, and the quantity added. So, my nose. I'm going to be adding, if I look at the MAR, 3 milligrams at a concentration of 1 milligram per milliliter. The time is 11:30 on April 17th. 19, and my initials bottom. Okay. So now that that is all ready, I am going to prepare my medication. I also want to prepare these saline collectors, before I go into the room, so don't spray anyone. So I'm just going to pull back and make sure it's tied again. Back in there. Alright, so yeah, getting the air bubble out of the saline lock. And making sure that cap's tight again, so those are all ready to go. Alright, so now I'm going to wash my hands. And I'm going to prepare my medication. Maybe I'll switch this around so I'm better view. Alright. So I'm going to open my syringe package here. And I'm just going to grab my monograph just to make sure that I'm reconstituting it in the right way. So yeah, dilute 1 milligram. 1 milliliter in 9 milliliters of normal saline. So that's what I'm going to do right now. So I'll be drawing up 9 milliliters of normal saline. washing my filter needle, and I'm using a filter needle because this is an ampule and there's glass present. Alright, making sure all the medication's out of my ampule, breaking it open. Okay, throwing that in the sharps, and then opening my normal saline sterile. Now that top is sterile, so I don't have to swab it, and I'm going to be pulling up 9 mils normal saline. Pulling back. I'm going to pull up a little bit extra because I've got a bubble. And just getting all the bubbles out. Alright. And I have my sharps container here, so just getting rid of the extra till I have 9 milliliters. It's probably a bit too far of the sterile water. And now I'm going to really carefully drop 1 milliliter of morphine. Trying to make sure I get no air into my syringe. Alright, and then I have exactly 10 milliliters in my syringe. I'm just going to draw back a little to make sure the medication's all mixing. And then I'm going to be wasting my medication. So because I have the 10 milliliters and it's 1 milligram per milliliter, I'm going to be wasting 7 milliliters to give me the dose of 3 milligrams that I need. So I'm going to waste over here onto the sharps. Normally I'd have someone watching me do this, but for the sake of this competency, I already have my waste accounted for. Just pushing all the way to 3 milliliters. There we go. And that's my dose. I'm going to cover this needle and then get rid of the rest of this morphine into the waste as well. I'm going to add this little blue cap instead of taking the needle into the room, just because that's best practice. Making sure I remain sterile. So putting that little cap on there. There we go. And discarding the filter needle into the waste. Alright, so I have that ready, and I'm going to put my label on now. Alright, so I'm making sure that it's not covering the numbers in my medication label, so I can still use my dose volume time and looking at those numbers when I administer the medication. Now I'm going to go into the client's room, move my garbage aside. I'm going to bring my MAR, my dose volume time math, my 2 saline flushes, and all of my alcohol swabs. I'm going to wash my hands. That one doesn't work super well, but now I'm in the patient's room, my hands are washed. Just going to move this all over so I have some space. It's all on the table instead of my hand. Okay, so hands are washed. I am here with the patient again. So this time I just really want to do my 2 patient identifiers. So I'm going to ask the client to tell me his full name, Frank Lipstein, and his date of birth, 01/18/1952, and I'm comparing that to my mark. Now I'm going to do my 7th and final, or sorry, my 3rd and final check of the 7 rights. So I'm looking at my right client, Frank Lipstein, looking at the drug, morphine. The dose, I'm going to give 3 milligrams, and I'm giving it IV push because it's the most effective, fast, and less invasive than the other 2 options. I'm going to give it now. It's a PRN medication, and he hasn't had it in 2 hours. And I'm giving it for pain management of his right femur, and then I'll be documenting just after I've given it that's happened. So that's done. I'm just going to do a quick IV site assessment. So I'm looking for any infiltration, phlebitis, any redness, swelling, exudate, something that would indicate infection. I'm going to palpate around the site, palpating for pain and feeling for hot or coldness around the insertion site. So it looks good for this scenario, we're going to say. And first off, I do want to do my patency check and my saline flush. So I'm going to be preparing, as I did already, I prepared my syringe. So I'm going to take that cap off the syringe now and swabbing the port of this IV for 15 to 30 seconds. And then once I'm done that, I'll let it dry to make sure that all the bacteria and stuff is gone. Okay, so connecting this saline flush to the IV and then unlocking the IV. So for the patency check, I just want to do 2 to 3 mils slowly, just feeling for any resistance, which would indicate that there's maybe something blocking the IV, that it's not patent. So this IV is patent, and then I'm going to give it a little flush turbulently from 3 to 5 mils, just to get any debris away from the insertion site. Then I'll take this off, and every time I'm going to be swabbing again, just to really make sure that the site is clean. And I have my medication ready here. So swabbing the site for the port for 15 to 30 seconds again. And then taking off my blue cap, maintaining sterility of those 2 ends, and then attaching it to the saline lock. So now I'm going to be doing my IV push, and I'm going to look again at my DBT, dose volume time, and noticing again I'm giving 0.5 milliliters in 15 seconds. So looking at my watch, I'm going to get it to a nice even number here, and then I'll start injecting. So here we are at half, so I'm going to slowly be pushing in the medication. 15 seconds for half of a milliliter. Call bell. Hi. Do I have to keep doing this?
How many have you gone?
30 seconds, no, 45 seconds.
Okay, go ahead.
Yeah?
Yeah.
Okay, so normally I would keep doing it at this rate, but for the sake of this video, I'm going to push the rest in at a very, very fast rate, which I wouldn't do in real life. Alright.
Okay, so the last 2 mils here, or the first 2 mils of this flush, I'm going to do it.
And then we're going to do our last saline flush here. I'm going to cleanse the port again for 15 to 30 seconds, let it dry. taking off the cap. And then for the first 2 mils of this flush, I'm going to be going at the same rate that I was giving the medication at, because there's still 2 milliliters of medication in the flush. So
I'm happy you mentioned that, so just go ahead and talk about what your end flush would look like. Okay?
okay, I don't have to do the
No.
really slow.
You already talked about it.
Okay. So now that I've done the 2 milliliters of slow flush at the same rate of the medication, I'm going to just do the turbulent flush to make sure that the IV is all good and patent. And then as I'm doing the 3 to 5 mils of the flush, I'm going to be locking the IV in a positive pressure. So that's locked. I'm going to take this off. And because I just gave an IV direct morphine, I'm just going to be monitoring the patient just to make sure, you know, are the reps slowing down, how are they feeling, and just kind of throughout that whole scenario, just making sure that the medication isn't too strong or they're going to go into an overdose. I'm going to then leave the room, so I'm going to wash my hands and I'm going to go document, and then just letting them know that I'll come back in about 5 minutes after I've documented to check on them to make sure that they're still okay and that, you know, the medication will peak in about 20 minutes. So I really want to make sure that they're, you know, not going into respiratory depression. I'm going to make sure they're safe, put the bed down, and that they're comfortable, and leave the room. Call bell? Can I stop it?
Yeah.
Okay.